I'm Mario, and this is my head-to-toe assessment.
Come in.
Hi, I'm Mario, and I'm going to be your student nurse for today. Can I have your name and birthday?
4/30/96 and Alexa Jones.
Okay, do you have any pain?
No.
What about allergies?
No allergies.
Okay, I'll be right back while I wash my hands and close the door for privacy. Do you know where you are?
The hospital.
Okay, do you know what year it is?
2016.
Alright, patient is alert and oriented ×3. She appears her stated age. Mood is appropriate for the setting, and her hygiene appears well kept. And okay, now I'm going to begin the assessment. Can I feel your head?
Yep.
Okay. Head is normal cephalic with no bumps or lesions. Hair does not appear to be oily, and it is thick, and there's equal growth distribution. Temperature is warm to touch. Face is symmetrical. Nose is midline, and her pupils are round and about 3 millimeters equally. Okay, so I'm going to have you look forward. Okay, now follow the pen light. Okay, pupils are equal and reactive to the accommodation and light test. Okay, can you open your mouth for me? Okay, tongue is pink and moist with no coverings or lesions. All teeth are present. Buccal mucosa is pink and moist with no lesions or bumps, and gums are pink and moist with no lesions or bumps. Alright, open your mouth one more time for me. Stick out your tongue. Say ah. Uvula is midline and mobile, and tonsils are present and are 1+. Okay, so can you smile for me? You puff out your cheeks. Alright. Now, close your eyes and tell me where I touch.
Forehead. Cheek. Nose. Chin.
Okay, cranial nerves 5 and 7 are intact. Alright. So now I'm going to go on to the carotid arteries. Okay, carotid arteries are both equal and bilateral 2+. Now I'm going to listen to them with my bell. Okay, I'm going to have you take a deep breath and hold. Okay, again. Okay, there's no signs of bruise. Okay, I'm going to do upper extremities. Skin is warm and dry to touch with no lesions and is ethnic appropriate. Can you squeeze my fingers? Alright, strength is good. Now I'm going to check the brachial pulse. Brachial pulse is equally bilateral, 2+. I'm going to check your radial pulse. Okay, is equal bilateral 2+. And now I'm going to check capillary refill. And since her nails are painted, I have to check on the sides. And all are less than 3 seconds. And there is no signs of clubbing. Alright, so now I am going to listen to your heart sounds. Okay, so this is the aortic, which is second intercostal space, right sternal border. Pulmonic, which is the second intercostal space, left sternal border, herbs, which is the third intercostal space, left sternal border, tricuspid, which is the fourth intercostal space, left sternal border, and the mitral, which is the fifth intercostal space, midclavicular line, and this is when I would listen for 60 seconds. Okay, so now I'm going to listen with my bell. Okay, listening to the mitral, tricuspid, herbs, pulmonic, and aortic. S1 and S2 were noted. Okay, so now I'm going to listen to lung sounds. Can you go ahead and take a deep breath for me? Again. Okay, so now I'm going to listen to lung sounds on your back. Deep breath. Okay, no adventitious sounds were noted. Okay, so I'm checking for the spine alignment. Spine is straight with no signs of scoliosis. And okay, you gonna tell me if there's any tenderness?
Nope. Nope.
Okay. And the AP ratio is 2:1. Okay, so now I'm gonna have you lay down. And I'll listen to your bowel signs and assess the skin. So the contour of the stomach is flat. There is no signs of lumps or lesions. Skin is warm and dry to touch. And now I'm going to listen. Okay. So right upper quadrant, there's the liver, the gallbladder, and the transcendent colon. The left upper quadrant, there is the spleen, stomach, and the head of the pancreas. And in the left lower quadrant, there is the ureter, left kidney, and the body of the pancreas. And in the right lower quadrant, there is the ureter, the right kidney, and the ascending colon. In all quadrants, there is bowel sounds noted. Okay, so now I'm going to palpate. And tympany was noted in every quadrant. Now I'm going to tell me if there's any tenderness.
Nope. 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 No.
Okay, I'm going to have you sit up for me. There is no ascending distension of the veins. Oh, can I have you lay back down again and do the Babinski test? your feet up straight, please. Okay, Dubinsky test was negative. Okay, you can sit up. And now I'm going to do the lower extremities. Okay, skin is warm and dry to touch with no lesions. And now I'm going to feel the popliteal vein, artery. Popliteal artery is present at a 1+. Now I'm going to feel tibial artery is present at a 2+. Now I'm going to feel the dorsal pedius, and that is present at a 1+. Okay, so now I'm going to have you stand up. And we're going to do the Romberg's test. Okay, can you shut your eyes for 20 seconds for me? Okay, Romberg's test was negative. And can you walk that way for me? And walk towards me. And gait is steady. And that concludes the assessment.